Hello everyone, today let's delve deep into the world of endocrinology and talk about the thyroid gland and disorders and diseases that affect it. We will talk about hyperthyroidism to be precise, but let's get to know the thyroid gland. The thyroid gland is an endocrine gland located in the neck below the Adam's apple. It is crucial in the regulation of metabolism, growth and development, nervous system functions, heart rate and cardiac output, just to mention few. It does a lot of things in the body. The thyroid gland produces two main hormones. One is triiodothyronine or T3. The second is thyroxine, which is T4. Let's get right into it and get to know everything about hyperthyroidism. Stay tuned. Triiodothyronine or T3 is the active form of the thyroid hormone, which is concerned with the regulation of metabolism. T4 or the thyroxine is the inactive form that is converted into T3 in the body. Hyperthyroidism or overactive thyroid happens when the thyroid makes and releases high levels of thyroid hormones. This speeds up several bodily functions and causes symptoms like increased appetite, unexplained weight loss, rapid heart rate, and anxiety. Thyroidism is treatable typically with medications, and the speeding up of bodily functions can affect your whole well-being and throw you out of balance. I am a living witness to what hyperthyroidism can do. So believe me, it is actually rare. It doesn't happen frequently. It is relatively rare. Signs and symptoms are increased sweating and sensitivity to warm temperatures, hand shakiness or hand tremors, unexplained weight loss, increased appetite, but when you eat, you still don't get fat because of the high metabolic state that you are in. You have high blood pressure, rapid heart rates, be anxious or nervous. You have insomnia, that is difficulty sleeping. You have bulging of the eyes, hair loss or brittle hair, and also diarrhea. The symptoms can actually start suddenly or can develop slowly over time. Certain medical conditions or situations that can cause hyperthyroidism are: one, Graves' disease, which is an autoimmune disorder that causes the thyroid gland to be overactive. It is the most common cause of hyperthyroidism. Thyroid nodules can also cause it. Thyroiditis, which is the inflammation of the thyroid gland, can also cause hyperthyroidism. Consuming iodine in excess through foods and medications can cause hyperthyroidism. Also, pituitary adenoma, which is a growth in the pituitary gland, can cause the release of excess thyroid stimulating hormones, thereby causing hyperthyroidism. What are the risk factors? You are likely to get hyperthyroidism if you have a biological family history of hyperthyroidism, thyroid disease, or autoimmune disorders. If you smoke, you are likely to get it. And then pregnancy or postpartum can also bring about it. I had mine when I had my first child, so postpartum brought it upon me. Diagnosing hyperthyroidism, healthcare providers do a physical exam to look for signs of hyperthyroidism. They also let you do a thyroid blood test. And in this test, if you have hyperthyroidism, the test will show that the results actually will show that the T3 and the T4 are above normal, and thyroid stimulating hormone is often lower than normal. A lot of treatment plans or options when it comes to hyperthyroidism. Your healthcare provider will discuss a whole lot of options with you and help you determine which treatment plan best fits your situation. You can be prescribed anti-thyroid medications that block the ability of the thyroid gland to make hormones. There is also radioactive iodine therapy, which involves you taking the radioactive iodine by mouth in a capsule or a liquid dose. The radioactive iodine targets the thyroid cells specifically and destroys them. This leads to the permanent destruction of the thyroid in order to cure the hyperthyroidism. So people who are given this radioactive iodine therapy must take the thyroid hormone medications for life in order that they can maintain normal thyroid hormone levels. A surgery can also be done to remove part of the thyroid or all of the thyroid to correct the hyperthyroidism. But this surgery will usually cause hypothyroidism, which may also require lifelong thyroid hormone medication. Beta blockers are medications that can help ease the symptoms of hyperthyroidism, such as hand shakiness, nervousness, anxiety, or rapid heartbeat. But they don't really change the levels of the thyroid hormones in the blood. So they can be prescribed alongside another treatment. Some of the complications you can get from hyperthyroidism are atrial fibrillation, osteoporosis, congestive heart failure, infertility, ischemic stroke, or thyroid storm. You can maintain thyroid health by eating a balanced diet, avoiding high iodine diets, exercising regularly, staying hydrated, and then you try and manage stress. Getting a new diagnosis can be stressful, I know, but the good news is that hyperthyroidism is treatable. It is highly treatable. So if you are having symptoms of it, or you feel like your bodily functions are going too fast, reach out to a healthcare professional. They can help you do simple tests so that they recommend the right treatment for you in order that you get back your body in balance. Like and share the video for me, subscribe if you've not done so yet, and then keep your comment respectfully in the comment section for me. See you in my next video.